What are the procedures and techniques used to battle dyspnea? So what are the procedures and techniques that we can use for intervention of dyspnea? We can use activity grading, breathing techniques, energy conservation, relaxation and assertiveness training, and assistive devices. As you can see in the illustration on the PowerPoint, one of the techniques that's commonly used, and I use myself when I talk to patients that are having trouble breathing or they're dyspneic or have a little lower saturation with their oxygen, I'll tell them to breathe through their nose and blow out the candles. That way they're not mouth breathing and they can take in the oxygen that they need. So our first technique that we're going to talk about is activity grading. It's a therapeutic strategy taught to patients so they may progressively improve their function as applied to everyday lives. Purpose of activity grading is to provide a level of challenge that will help people progress in needed skill areas without overwhelming them. So what the therapist would do is set a goal for the patient and they will slowly work towards that goal. For example, if they say, okay, today we're going to walk 10 feet and then by the end of the week we're going to try to work towards walking 20 feet. So you try to set a goal for them that will not be overwhelming and that's achievable. Our second technique we're going to refer to is breathing techniques. It begins with awareness and it ends when patients view the techniques as tools that they can own and control. A lot of our patients are very anxious. They get short of breath very easily because of their lung disease and damage to their lungs. So important that they know how to do their own type of breathing exercises to help relax their breathing and get in the most oxygen that they can. So these breathing techniques should be done on an individual patient basis as each patient has different awareness of their breathing patterns. Who knows better the patient than themselves? Instructions should be followed by immediate practice if techniques used are to become natural habit. So always encourage the patients when they're having shortness of breath to follow the proper breathing techniques as they've been educated. One of the breathing exercises that was previously mentioned was the breathing through your nose, what we call smell the flowers and blow out the candles. That helps the patient slow down their breathing and relax so they can get in as much oxygen as they can into the lungs and bypass the mouth, which sometimes they breathe through if they're short of breath or having trouble. Another technique that can be used is what we call pursed lip breathing. That's when the patient is going to close their mouth tightly and make like a pursed lip parted at the center and almost like a whistle, and they're going to breathe in through their nose and then they're going to exhale out through their mouth nice and slow. So their inspiratory phase is going to be twice as long as their expiratory phase. The patient should be in a nice relaxed position, seated or supine. Energy conservation is another technique that's used to help the patient learn how to ration out their activities throughout the day so they won't get tired and over fatigued. It's used to help patients balance ADLs over time, for example, cooking, cleaning, or even going to use the bathroom and cleaning up for the morning, taking a shower, brushing their teeth. Compressing all the ADLs in the morning can lead to severe fatigue in the afternoon. Some patients, because their lungs are so damaged, just even the most simplest activities that we probably would take for granted is very difficult for someone who has severe COPD or lung disease or compromised lungs in any way. Overdoing activities in one day can lead to severe fatigue for several sequential days. So even if they're wore out, we can rest and recover and bounce back. But for someone who has severe lung disease, it may take them several days to recuperate. When using the techniques of energy conservation, planning is the key for patients who have severely compromised lungs. Some of these patients have to learn how to adapt to energy conservation practices by consciously planning their time used over the day, week, or even month. Other patients will lack the ability to do this and require assistance from the rehabilitation therapist to develop an occupational plan. Because some of these patients don't understand their bodies, they don't realize the severity of their compromise, and they need a little more guidance to be able to conserve their energy so they can continue to do the activities of daily living without difficulty. The occupational plan schedules activities so that priority activities can be accomplished with a minimum fatigue and frustration. Prior to developing the occupational plan, the patient or client should be instructed to keep an occupational journal. Keeping journals of usual routines and habits prior to developing a plan will help patients better devise and implement their plan. Patients will be more consciously aware of the effect their activities and overall patterns of activities have on their physical and psychological well-being. This helps the patient to better learn their limits, and the therapist can certainly help them with their activities and come up with a better or easier way to perform their activities throughout the week or the month. The key to success for these patients is planning, as stated in the previous slide. There are 1 through 7 steps that can be very important to the patient to make sure they're utilizing and doing in order to make sure that their activities of daily living can be achievable. Number 1 states to limit the amount of work. It's important for the patient to prioritize activities, eliminate unnecessary tasks, delegate responsibilities to friends and family as much as possible so they won't wear themselves out with fatigue, and request assistance if they really need it. 2, plan ahead and work accordingly to the plan. Allow sufficient time to complete activities. Be sure that they take rest breaks according to their plan and collect materials before they start so they don't waste unnecessary energy. Number 3, organize your environment. Place frequently used items in easily reachable areas. Organize the kitchen by function and try your best to eliminate clutter. Number 4, position yourself for comfortable efficiency. Sit whenever possible to reserve your energy. Use proper body mechanics and posture, and always wear comfortable clothing and supportive footwear. Number 5, take control of your time. Pace yourself to avoid rushing. Spread activities over the day or week. Be sure to take multiple rest breaks and rest before you get to the point of exhaustion. Number 6, let the tools do the work. Use assistive devices such as reachers. Use convenient items such as microwave and electric can opener to conserve energy. Keep scissors and knives sharp. Number 7, tend to your mental hygiene. Stay relaxed. Use activities to keep your mind off of worries. Be sure to get plenty of rest and use the relaxation techniques that we learned earlier in the previous slides. And of course, with anything that you do, you want to make sure you have fun every day. Relaxation and assertiveness training. Patients with lung disease often suffer from anxiety and may benefit from some form of relaxation training. Rehabilitation therapists should affirm that the patient's rights to relaxation and a sense of inner peace should point out the benefits of relaxation to performance and well-being. Always encourage your patients when they seem like they're high stressed or high anxiety to do those different types of relaxation breathing techniques that we talked about earlier in the unit. Diaphragmatic breathing, pursed lip breathing, and even yoga may be something that the patient may benefit from even as a side hobby. Assertiveness training encompasses the following: validation of the patient's worth and their right to express needs and opinions. Who knows themselves better than the patient? Give them that opportunity to kind of tell them what they need and accept or decline whatever they feel is not beneficial to their treatment plan, within good reason, of course. Number 2, understand the importance of honest and clear communication. Remember, these patients are compromised. They don't have the energy they used to have. They're not active like they used to be. And they're embarrassed about it. Some of these patients are elderly and they don't like accepting help from others. But the most honest they can be, the better we can be as far as planning their care plan. Some of them still continue to smoke and use tobacco products. They're not always forthcoming about that because they know it will be frowned upon if they were honest about it. So always use keywords that doesn't seem threatening, and just kind of use terms in a way that it gets the most out of your conversation with them so you can get the better treatment plan to enhance their recovery. Number 3, skill training with the timing, words, and body language of assertive communication. Never come across defensive with the patient, even if they're not being compliant with their care plan. Always tell them the things that they're doing right before you tell them the things that they're doing wrong. More patients are more receptive to that. You're doing good at this. However, there's one thing that you're doing wrong, and you should maybe do it this way, and tell them the benefits why. These are the key things that are needed and appropriate to take care of these type of patients so they'll do well in the rehab setting. The last technique we're going to discuss for this unit is assistive devices. It can be physical and or cognitive in nature. Physical devices may include shower chairs, grab bar, soap on a rope, long handle shoehorn, Velcro shoes, ties, walker, and other type of devices. This helps the patient to have more independence and it helps them to reserve their energy. Cognitive devices include the following: a computer, daily planner, and as we've spoken of before, journals. This helps the patient, especially the elderly, to remember things that they need to do, and it helps them to stay on track with their care and make sure they're meeting their appointments. This concludes the PowerPoint for Unit 1B.